Because somebody working through an ACP pathway or being an ACP may work in very many different practice contexts, it's really important for a supervisor to understand that and to understand the demands on the person and the challenges that they will face, and be able to support them in thinking through what are the boundaries of those contexts.
Myself and my colleagues working in emergency medicine are very clear what that practice context is, and we have a established Royal College of Emergency Medicine advanced clinical practitioner portfolio and credentialing, which we are working through. In other contexts, it's not entirely clear what people's roles are, and indeed they may have established new roles in a practice context. I'm working closely, for example, with somebody who's working an advanced practice role with an acute stroke, and there isn't established curriculum or definition of his role and how he's going to be working within the stroke team. But establishing the practice context is really important to understand the role that somebody needs to undertake and what skills and knowledge and assessments and ongoing competence and knowledge that that person may need, and therefore what supervision and who would be suitable to supervise, and to be able to understand that.
From a clinical perspective, and this is most important around the clinical pillar around supervision, we'd make sure that our ACP supervisors are consultants or very senior ACPs working in that clinical area. So for example, our oncology ACPs are supervised from a clinical perspective from a consultant who's an oncologist.
It's also really key that people understand the roles and responsibilities and capabilities of the rest of the team. And within primary care, that team's massive. So you really need to work out where you fit as an advanced clinical practitioner. And that's something that good supervision can help support to embed.